You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
Welcome back, everyone, to another episode of Amp Life Talk Radio. I want to welcome everybody back to the show, Amp Life Talk Radio, a show for amputees and those affected by limb loss. Those of you out there listening to us on Spreaker and all of our other platforms, iTunes, iHeartRadio, Spotify, and even on our official app that we have out there. Welcome. And how can I forget the new audience that we're trying to develop over on YouTube? Thanks, everyone on YouTube for tolerating some of the different things that we do here. But hey, I think after all the edits are done, that show actually is coming together very well over on YouTube. Yes, for those of you that don't know, we are no longer doing the live video on Facebook. You have to go over to YouTube and type in Amp Life Talk Radio over there to actually hear us or to see me. You can hear me here on Spreaker.com. But if you want to see the live shows, which I want to make sure everybody understands too, I'm not going to do a live video every single show. So sometimes you will not see me doing a live show on YouTube. What I will be doing too on YouTube, and the reason we moved over there, is we want to make sure that we're doing more of the educational videos. So, and I know there's a lot of people out there doing different things like that. I know there's what is her name? The OT amputee, no hand banded. There's a lot of people. You have a lot of good selections out there, a lot of good people doing a lot of good things, trying to offer free services to amputees out there. And I totally support them 100%. In fact, I think I subscribe to all of their channels and follow them. You just kind of pick and choose what you want. I'm not going to do too much. I'm going to actually be working with my practitioner from my company, Synergy Prosthetics, and we're going to be putting together a series of videos and talking about different things, trying to help educate amputees about their prosthetics and how to do things. So YouTube is going to be a very useful tool for what we do here on the talk show. And just so most of you know, YouTube family, you guys don't know, the Spartan races, as you can kind of see behind me, I'm going to be doing some broadcasts from some of those races that I have coming up. We have some really cool stuff that's coming up. I have one in the beginning of November, in the middle of November. 3rd and 4th, we're going to be doing a race. And then I think we have one that's on the 17th that's actually going to be broadcasted live on ESPN, because it is the first adaptive Spartan race that's going to be held out in Laughlin, Nevada. And that's on, I think, the 17th. So myself and Dave, the one-legged bandit, the one-legged Spartan, we're going to be going out there and representing. We have a team of 4 guys. I got to meet the rest of my team. But Dave, the one-legged Spartan, has set that up and invited me to be a part of that. Man, these guys are young. I got to get this fat body in shape and get ready to compete with these guys. But we're going to do some videos out there, and I'll introduce you to our team and let you get to see some of the stuff that we do out there. So make sure you do go in and save our YouTube channel and subscribe to it, because that's where you're going to be seeing all that cool stuff. I will, once the videos are done, I will come back over and post those over to Facebook. So to kind of explain to you some of the changes that we do, and typically I do changes at the end of every year. As we're coming up to the end of this year, I'm trying to do some changes that makes, I want to make the show a better listening and viewing experience for you, my audience, the Amp Nation. So hopefully you like what you're seeing. And I think one of the coolest things about being able to do the YouTube videos for the show is that I've already seen people responding with comments to the shows. And that helps me, because typically on Facebook, you get locked out once you do a show. Well, this way you can respond to me with comments on each video that I do, which helps me, because then I don't get shows mixed up and I don't get things mixed up. If you're commenting on that show, then we know what we're talking about and I can better help you. So That's a really cool feature that YouTube offers us. And again, I want to say welcome everybody to Amp Life Talk Radio, a show for amputees by an amputee. Whether you're new or whether you have listened to me before and watched the show, I want to welcome you all back. I'm very excited to have you here, and I appreciate all of your support. Share the show, spread the show so that we can get more people tuned into what we do here. Uh, Again, Amp Life Talk Radio is a talk show that I try to put together because I want to empower amputees with knowledge and support to make a real difference. And I want you to also know that if you're an amputee, you're not alone out there dealing with limb loss. So tonight we have a show that I came up with because, as most of you know, I'm in a couple social media groups on Facebook, and I read comments all the time, and I try to come up with different topics that are going to be relevant to you and what you're going through. So tonight's show is titled um, "Your Emotional Well-Being," and I know when you hear that, what does that mean? Well, it means exactly what it means. As an amputee, one of the things that doctors do very well and medical health professionals do is they help you heal. They help the incision line heal. They help all the scars and all the wounds. They're good at healing those. But when it comes to amputees, it seems that there's nothing out there for the emotional trauma and injuries that we suffer. So tonight, I want to put this show together. The type of amputations the person uh, receive. So when you're out there and we're dealing with amputees, these amputees are all getting all different types of amputations. So when we look at this, the type of amputation, the person's health, their age, and all these other factors that uh, basically are going to increase your chances of having complications as a result of your amputation. These are things that are going to leave emotional uh, wreckage, damage, issues. Um, you're going to have to sort through that. Though it seems odd, the risk for serious complications after an amputation uh, are particularly higher when you talk about planned amputations than it is for emergency amputations. Why is that? Why do you think that is? Well, this is due to the fact that most planned amputations occur in older patients, older people. This is something that is related to possibly some type of disease or vascular issue. So, in older victims or older amputees, um, people that suffer from disease and stuff like that, um, with with that, you're going to be looking at a history of poor health, chronic health conditions and issues. Like I said, diabetes. Now, those are going to be the ones that are they're going to be dealing with a lot more on their plate. Now, a planned amputations, when we talk about planned amputations, that's been scheduled, uh, usually are sometimes the last resort, meaning you either get the amputation or you die. You either get the amputation or you live with a bad leg that you'll never be able to walk with. Treatment options due to these high risk complications um, are more extreme, we'll say. Planned amputations are only done um, if there is no other way to prevent something from seriously happening that's threatening your life. Symptoms like gangrene, uh, blood circulation, blood flow, all these things. After the amputation, one of the biggest risk factors for an older amputee or older patients um, and sometimes young people develop diabetes and some of these issues. I've had a couple patients like that. Uh, is reduced activity. So once they go through something like this, just about every amputee out there, we all have experienced a reduction in our ability to get up and move around. And this uh, thing right there, that one thing right there, can foster depression, especially among elderly amputees because they're going to have an even harder time of getting up, getting around, and doing the things that they need to do. Amputees suffer psychological effects after an amputation. I know when I say that, some of you probably um, know that that's so true. Feelings of loss, similar to experiencing the death of a loved one, that is the most typical feeling that most amputees feel. And the thing about it is, most amputees don't even know they're feeling that until somebody kind of talks to them and points that out. This loss of sensation from the limb and the change in their body image of their person that they used to be, these psychological issues uh, often cause some serious negative thoughts and emotions with amputees. This is especially true in people who had an emergency amputation, as they did not have time to properly mentally prepare themselves for the effects of the surgery. So, tonight's show, we're talking about your emotional well being. I hope that you are ready to be honest with yourself, really ask yourself some tough questions, because tonight's show, I really want to share some information with you that's going to help you, hopefully, gather a better feeling of where you're at and what's going on with you as an amputee. So stay with me. Let's talk about this subject more right after this.
Sean Harrison.
Now, as we come back from the quick little break there where my music was trying to cue up, um, Living with Clip Wings is the title of this section of the show. But before we even get into that, I want to give some special thanks out for some of the supporters of the show. Um, Sound clips and all the different sounds that you hear me play for the show. I have to thank my main man, Rich, at Soul Effective Productions. Check him out on Facebook. If you're really into special effects and sound and drums and guitars, and if you need sound production, video production, he's a awesome guy, very smart. He has a wonderful studio here locally in California. Check out my good friend Rich at Soul Effective Productions. He's on Facebook. He's on my page, but he helps us sound good when we do things here at Amp Life Talk Radio. Living with Clip Wings. We've been through the amputation. It's time to try and reestablish our life. It's time to try and get back to living. But how do we do that with Clip Wings? We want to fly, we want to soar, we want to be that person that we were. Well, we need to understand that depression, anxiety, denial, grief, the possibility of suffering post traumatic stress disorder, PTSD, and even suicidal thoughts are all common psychological side effects or effects after an amputation. Facing limb loss can be confusing and challenging for patients and their family. The consequences of losing a leg gradually materializes as the patient realizes how the loss of mobility will limit their freedom and independence. I mentioned before elderly patients. People over 65 account for approximately 3/4 of all surgical amputations. Of that, 100 each year, and that number has probably went up. 85 to 90% involve removal of a lower limb. Amputees were not able to resume their formal activities and contacts, which influence their jobs, hobbies, social activities, and so on. In this new situation, we're going to find that amputees are forced to depend on others. I know I was. I know you probably are. Their world, in essence, shrinks. It's almost like you went from having this wonderful life to now you feel confined. This restriction of life is related to the sense of uh, great losses, not just the loss of the limb, but the loss of independence, the loss of mobility, the loss of social interactions. This essential meaning of losing a leg or an arm or a limb, any limb, is a radical uh, existential upheaval in this person's life, which restricts most amputees' lifestyle and um, alters their world, basically. I mean, you have no other way to look at it. It's going to alter everything in your world once you go through an amputation. Life after the operation is associated with despair. Studies have shown patients who go through amputations associate that with despair and a painful sense of loss. The amputee will find themselves in a place of limbo, and they want to strive and to regain a foothold on their life, but they don't know how. They continually push themselves in an attempt to reestablish this former life that they had, to come to terms with their new identity as physically impaired. This can lead to a change of roles, self esteem, the restricted physical mobility prevents amputees from carrying out their customary roles in their relationship, their household, their job, their life, in just their everyday, normal errands, running around, doing the things that they typically do. And it can lead to them playing a more passive role, which they may not be ready for. They were probably the mom that took care of everybody, the husband that went out and worked. These role changes affect us once we go through limb loss. The clipped wings that we no longer have because we can't soar, we can't be that provider, that comforter, that person that goes out and gets things done. Our wings have been clipped. How do we deal with that? This new role is perceived as less meaningful, and the amputees will strive to maintain their sense of personal dignity and symmetry in their social work, relationships. Mastering these new ways of handling everyday routines is a very important step on the road towards reestablishing a new and acceptable role in this new life. Establishing your emotional well-being. The loss of a limb involves changes in amputees. It involves changes in their bodily awareness. Patients need to familiarize themselves with this or with their new body and to learn these new skills related to all their home appliances, cars, showering, that will help them compensate for the loss of this limb. The effects of the amputation can be further elaborated in the following ways. When they look at home as a confined space, maintenance of symmetry and dignity in social relationships while out and about, reconstitution of bodily confidence, feeling more confident when they're out in public, having people look at them, worried about the missing limb or their prosthesis, how they wear it, what are people thinking? Hope and willpower as driving forces they will need to help them establish some type of meaningful role back into their life. And then for the elderly people that we talk about, dependence on care and rehabilitation becomes a big factor. When we talk about some of the things that I just mentioned above, home as a confined space, what does that mean? I think most of you do know what that means. But coming home after an amputation, I posted this question on Facebook and I got a couple responses, and I'm going to read those responses as we get further down here. But I wanted to get some feedback, live feedback from you, my listeners, on this topic. Coming home can be an ambiguous experience for both happiness and problems. We're going to experience both. Yes, we're happy, we're home, we're out of the hospital, we're out of the skilled nursing facility. But now comes the problem of how do we maneuver around our house with this new situation we have? The challenges of everyday life materialize quickly as a result of the restricted mobility we now have. Going to the bathroom, getting into the kitchen, having a cup of coffee, or fixing your own cup of coffee, doing the things that you would typically do, making dinner, just going to watch your TV show, watering your garden, watering the grass, playing with your pet. Home can suddenly change and become an obstacle race in which doorsteps are now huge barriers and stairs can turn into mountains that you may have to climb over and over again just to get into your house or to get upstairs or to get to a bathroom. Everything can change. Everything will change. Everything can be more difficult and take more time. Key word, everything takes more time. So when we get home, we have to realize with this new situation that we have, this new life we have, it requires more time. Household chores become a burden, even down to the tiniest little detail. The favorite chair might be impossible to sit in now because we sink in too much. And fetching your child a glass of water as a mother, that becomes a burden. It becomes hard. Or picking up something from the floor becomes a laborious task. Physical mobility can strongly be linked to freedom and independence. Losing those affect us emotionally, affects us with our well-being. Having difficulties getting outside of the home contributes to amputees experiencing home as a prison sometimes, in which they feel isolated and confined. Do you find yourself in this situation? Are you finding this talk tonight hitting certain emotions? Well, if you do, stay with me and let's talk about this. Let's figure this out. Let's delve into this. Your emotional well being is so important. As we get ready for this next segment of the show, we're going to take a quick break and I want you to gather your emotions, think about what we're talking about, and be ready. We must be ready for these things that are going to be coming at us as we come home from the hospital, the skilled nursing facility. How do we now get ourselves back into the symmetry of our life? Before we start the segment of the show, I want to thank my company, Synergy Prosthetics, for all that they do for the patients that we see, and thank them for sponsoring my show. Synergy Prosthetics, we have offices in Southern California, the Bay Area, and Sacramento. If you are in the Central Valley area and you would like to work with me, reach out to me, contact me through my Facebook page, or contact my company, Synergy Prosthetics. Emotional well-being is what we're talking about tonight. We left off with maintenance of symmetry and dignity in social relations. So how do we do this? What does that mean? I think both amputees and their network take on a new, unaccustomed role when you have gone through an amputation. The patient and their network, you are now on new ground when you get back home and you go into these situations, which these new roles, which will redefine how the amputee, uh, as a recipient, um, in these roles, how you're going to deal in these social settings. Um, to be unable to do the same things as before, or to be a potential burden to others, will be something that all amputees associate with their feelings of inferiority, feeling inferior because we can't do what we used to do. We need help now. You want to go to a social gathering, a party, somebody's having a birthday party, a wedding. It's different now going into those settings. Your self esteem now is threatened, and you may struggle to maintain this symmetry and dignity in these social relationships that you're going to be engaging in. As an amputee, we may experience um, being a spectator, and that's no fun when you go from being able to go out and indulge and be a part of something. Now you feel that you are no longer able to participate, but you now have to be a spectator. And this potentially marginalizes your life in these social settings. Your integrity under these pressures, um, no matter how hard you try to avoid feeling marginalized, by saying, I am who I am, I'm going to do this even with one leg, I'm going to be able to do it. It does affect you. This altered appearance could cause an amputee to feel invisible. It can also be very painful for an amputee to be ignored, and they could experience loss of dignity. One way of maintaining dignity in these situations is to demonstrate that an amputee could also be active and independent. Well, I want to say this, and I want to ask you this question. How would you do that in this situation? How would you demonstrate that as an amputee, you could also be active and independent in these social settings? Think about that. With or without a prosthesis? Think about that question. How do you demonstrate that? Reconstitution of bodily confidence. So, how do we reconstitute that confidence in our body when we're out and about and going into public? Keep in mind, the stump is not just a shorter limb that was functional at one point in time. The former, uh, it was actually a part of you, a familiar body part that has been completely changed now. Normal actions such as changing position in bed suddenly uh, become a big obstacle. they become uh, they become different and even difficult. I know for me, uh, being in bed with my lady, sometimes when I go to roll over, I shake the whole bed. Well, that's what at least she tells me. I move the whole bed. She forgets I am a big dude, so and she's little, so I am gonna move the bed a little bit. But little things like that. I mean, even just going from laying to sitting becomes difficult because of weight distribution. And these things could cause you to lose a good night's sleep trying to find a good position. Most of you that are missing lower extremities and upper extremities, you know what I'm talking about. Um, Trying to find that comfortable sleeping position is sometimes hard when you're laying on your side and you don't have a foot or you don't have an arm. You have to do certain things to get that. I tend to sleep with a pillow between my legs. I just started that of late, and it really helps me out with my lower back. Um, the lack of body confidence can also lead to um, deterioration, uh, sense of balance. You feel off, and that can happen. You feel kind of out of place. The difficulty in keeping body balance could frighten and dishearten most amputees. Gaining body balance helps you feel safe and secure. And elderly patients, as they go out, they have a sense of safe and security, especially if they're walking with a prosthesis. They don't feel they can take care of themselves, fend off someone, or do the things that they typically could do. This can simulate courage to try things that we probably shouldn't and get ourselves into a situation. It can also, for the younger amputee, stimulate that courage to try to do things that we're scared of, stepping up on a curve, trying to look normal, challenging you to go outside your boundaries a little bit where we typically feel a little bit more comfortable at. The road to achieving confidence with this new skills and with these new skills involving the mastering of our newly formed body, it's going to require us working on these new body skills that we have so that we can feel more safe and secure as we're out doing things. The altered body can lead some amputees to experience phantom pain sensations. I had a patient today I'm seeing, and he's good with in fact, his residual limb is numb, but he's getting a lot of phantom pains. Those out and about can cause issues as you're basically in pain. You're having shocks. You're having all these things go on, and you're trying to look like nothing's affecting you. The amputees discover a form of contact with their amputated limb. I've got him doing some different exercises, moving his toes, his ankle, trying to help those nerves settle down a little bit. It is important for amputees to not let the phantom pain take over, but learn how to accept it as part of their changed life. Everyone is going to have them, but you can't let it consume you and get you to a point to where you don't want to do anything. Becoming familiar with phantom pain um, on an acceptable level could make it possible for you to come to terms with the altered body that you now have. What does that mean? Well, what that means is phantom pain is a constant reminder that there is no limb there. The more we are able to accept and deal with that and understand that that is a natural part of our new existence, means that we're going to be able to come to grips with our new life. Hope and willpower as driving forces. I think that's pretty self-evident. Hope and willpower as our driving forces to get ourselves to a healthy place with our emotions. Despite the radical changes that were life restricting in various degrees, you as an amputee may also experience that the altered conditions of life were connected with hope. For example, the amputation could be the only way out of a deadlock or hopeless situation, such as you have had a foot that does not allow you to walk because of pain. Um, Getting the amputation, getting into a prosthesis allows you now to be able to walk with a limb that didn't work before. We had a young man on our show, um, Mason Hall, who's now a uh, he's a strongman. Club foot was his thing that led to his amputations, bilateral below the knee amputee. But if you see Mason now, he's doing incredible things as a strong man. So when we talk about these things, hope and willpower as driving forces, um, he's no longer restricted by what was keeping him back. He's able to now live this life that he's always wanted to live. Live with pain in a limb, limbs that don't necessarily work, limbs that don't allow us to walk properly or walk at all. This is what we're talking about with that limb or amputation as a sign of hope. The amputation allows us to regain some sense of life, some sense of mobility through that amputation. So when we get that amputation, we have this hope that once that's done, we're going to be able to go back to getting that life that we've wanted. Although amputees are anxious about the future, and I think most amputees are anxious about the future once they go through their amputation, most of us try to keep it positive, and it's hard. Trying to keep a positive attitude towards life is hard when we're talking about the future and amputations. Some will struggle to find the willpower and stamina to carry on with this life, and they must work with determination towards increasing their mobility and freedom. It is not easy. It is not easy. I was just at a patient's rehabilitation session today at Emmanuel Rehab. And after a short, brisk walk on the treadmill, he was winded. And he is seeing that after having almost 2 years of not walking, how he needs to work at now walking again. And it was awesome to see him have that determination towards increasing his mobility, getting his freedom back that he had lost for those years. The road to independence involves continually exploring and expanding your personal boundaries by fulfilling your goals. And we're going to get into your goals later on in the show. But remember that the road to independence involves continually exploring and expanding your personal boundaries and goals, pushing yourself. You must produce the willpower to constantly change yourself in order to regain the maximum former self that you were, to regain that maximum former mobility, independence, freedom that you had. You're going to have to constantly change yourself by getting up every day, putting on your prosthetics, making it a part of your life, going out there, being willing not to give up, setting those goals, because the alternative is quitting. That's not an option. Resigning, resignation, which means you give up. And now you're going to accept this marginalized life that restricts you to a wheelchair. Do you really want that? What are your goals? Think about that. We're going to touch on that a little bit later in the show. I want you to think about that. But do you really want that marginalized life? Or do you want to get out there and fight for it with everything you have in you to get that sense of peace, to get your life back? Many amputees see prosthetics or a prosthesis as hope, a lifeline, we could say, a lifeline that will give them back that active life that they had. The prosthesis is a symbol of hope, a symbol or symbolizes their hope of walking again, touching, grabbing, lifting, working, of becoming more independent and returning to that former life that they had, or as close as possible to it. That's what that means, hope. Hope is everything. Prosthetics can provide you with that hope. So when we're talking about the mental well-being, how we process it is a big part of how we view things as an amputee. Establishment of a meaningful role in life. We'll be to that after this quick break.
Sean Harrison. Harrison.
My music had a little hiccup there. I tell you, computers are great until they don't work, huh? So, and for you on YouTube, I don't think you guys hear a lot of these little clips that I do. So I'll try and put you some stuff in there that you just don't just see me sitting here being quiet and drinking a drink of water. So I'm sorry about that, guys. Um, let's get back to the show. But before we do that, I want to give a shout out to Valley Wound Healing Center of Modesto, California. I work with these guys with all my patients and with all of their patients. It is an awesome place, hyperbaric chambers. They are probably one of the best places here in the Central Valley if you have a wound that will not heal. Valley Wound Healing Center of Modesto. Establishment of a meaningful role in life. What does that mean for amputees? For amputees, establishing a new role and becoming whole again involves reconciliation with their altered life condition. This process is time consuming. I'm going to let you know that right off the bat. I'm not going to sugarcoat it for you. I'm not going to make it easy. I'm not going to make it sound like it's something that's going to be easy for you to do. If you want this, it will be time consuming. The process is worthwhile, and you got to want it. You got to be motivated. Because this process is time consuming and could not be forced, as it involves accepting, hear that, accepting this new life. Although the life had changed forever, it is something you must accept. And you have to understand and realize your life is still worth living, even with an amputation. Establishing a meaningful role in your life. Does your life still have meaning after the amputation? You have a lot to live for. Look around you, family, friends, kids. You have a lot to live for, but it's going to be work and it's going to be time consuming. Amputees must fight to reestablish themselves at any level. They're going to have to fight to reestablish themselves on many levels. From reviving previous interests, say you liked fishing, say you like roller skating, say you like just walking, to trying to maintain just personal relationships. Reestablishing oneself in life requires great willpower and creativity. Overcoming even the tiniest obstacle is an important victory for you. The hope of reconquering that former self, the former interests, the former habits and goals and dreams is a way to reestablish feelings of normality, being normal, and a certain degree of freedom. However, to regain that former life involves being confronted with your new life and the limits of possibilities that it presents to you, which can be painful. I post this question on social media, and here are some of the responses I got back when I posted this question with regards to this show that we're doing tonight. And my first response came from Beth Collins. So, Beth, I want to thank you for taking the time to respond. She said basically when she returned home from her skilled nursing facility or the hospital after amputation, returning home, it was hard to get around the home in my wheelchair. Need need to make sure when you buy your home, it's accessible. Have I've had to learn a lot of new ways of living my day-to-day routines, and that is so true. If your home, things that you never thought about, steps, your shower, your bath, your toilet, your kitchen, your sink, all these things, if you didn't think about it before and then you come home after you have had an amputation, these things can have a great effect on you and your emotions. And I had Joseph Kowski. I hope I said your name right, Joseph. Don't kill me. Don't hold me to it. Joseph was the other one that responded to that question, and he said, "I was basically a baby, or invalid in the beginning. Could not do anything for myself. Recovery was very slow. I had to learn to do everything again, but different than before." And remember what we said earlier in the show, and he hits on this. Became invalid. He was like a basically like a baby. So we have to be prepared for this because these things take their toll on the emotions being back into that situation. And last, we had John Holman. John's a good friend of mine. He's been on the show. Hopefully, you guys have heard his interview. And if you haven't, look through the podcast and you'll see the interview that John did with us. Um, awesome interview, especially when we're talking about what we're talking about right now. Go listen to his episode. John's a great guy, and John commented, "It was all about me taking time to learn and manage behaviors." So these are three different people from three different backgrounds, and they all touch on everything that I've put into this show about your new life after an amputation, what it's going to require, some of the things that you're going to experience when you come home. When you return home, how do we work on our well being? How do we work on keeping our emotional uh, mindset, our emotional self, our emotions from getting the best of us? And the last one that we talked about, dependence on care and rehabilitation. That's more for, I think, an elderly person or someone who has really suffered a lot of traumatic injuries. So if we have someone that has went through something like that, they will probably need a lot of that. The right type of help could actually increase the patient's quality of life and their outlook. A handicapped vehicle, such as other things such as a motorized wheelchair. All these things can be a positive to restore a certain degree of freedom and independence for patients who will require some type of care or rehabilitation. In reverse, not having the right equipment can reduce the potential for independence and mobility, as patients will have to rely more on others to help them do what they need to do. Now, this means they will feel very restrictive and cut off from the outside world. So, that part of it, we need to make sure if we are in that situation, we're getting the proper professionals there to help us so that we don't experience that restricted, cut off, uh, isolated feeling from the rest of the world. One of the things that's going to play a big role in this is age. Elderly persons undergo lower extremity amputations are at high risk for a functional disability. It's just because of their age. So when we're talking about this emotional well-being, it's really harder for them to be able to do some of the things that we're talking about tonight. But if they can, I have a guy right now, Mr. Burlington. Man, this guy's a go-getter. He's 83 years old, I think. And this guy is an above the knee amputee, but he motors, man. This guy does not let things hold him back. He's probably one of the more active elderly amputees that I have seen that has not let his amputation hamper him one bit. I mean, this guy, he's a beast. But age is going to play a big part, and like I said, particularly in above the knee patients. However, uh, previous research does provide a little information about the specific factors that predict such increased risk for patients like this. And unfortunately, depression and some of the other things that we talked about will accompany them when you start talking about limiting their restriction of their normal activities and lives and being able to get out and uh, do physical activity. PA is an essential for aging well with a disability. And if they can't do that, it's going to really cause some problems down the road. If you are an older patient with an amputation, the more you can get out and do physical activity, uh, it's going to help prevent some of the onset or worsening of chronic conditioning or conditions, functional loss, and will help you maintain or improve your quality of life just by getting out and doing some physical activity. Keep those levels low. Don't push yourself too hard, and just try to get out and do the most simplest of things that will definitely help you maintain a good mental health. Um, we find that when people can't do that, um, the physical activities, they suffer drastically with emotional issues, depressions, and anxiety. Now, one of the things that you got to keep an eye out for, whether you're an elderly person or whether you're a young, active person, some of the things that are going to prevent you from being able to do some of these things, physical activities for yourself, whether you're young or old. This is probably one of the best things you can do. Things that you need to be aware of is a poorly fitting prosthesis. That can lead you to low self efficiency, insufficient resources, unsupportive uh, uh, family or friends, and hassle. These are things that we found that um, hamper this process of bettering our well-being. Um, Now, the question you want to ask yourself: are you experiencing any of these? A poorly fitting prosthesis, insufficient resources, unsupportive uh, help, family, friends, or you're just having a hassle trying to get the things that you need. If you are, reach out to Amputee Coalition of America. They have some really good resources on their page. If you reach out to me on this show and type me a comment, I will do what I can to put you in touch with the resources that I know about also. So please do utilize this show, myself, and Amputee Coalition of America for trying to get some resolution to some of the things that we just talked about. Now, other factors that could affect your well being currently, your family's reaction can have a powerful effect on your adjustment. So that's something that I don't know how many of you have experienced that or went through it. I have talked to people who have become amputees, husbands, wives, boyfriends, girlfriends have left them. They have lost friends because of it. And it's one of those things that you hate hearing about, but it does happen. So this is probably one of the bigger factors that affects your well-being um, when we're talking about emotions. These have a profound effect on amputees. And keep in mind, these include your friends, co-workers. Uh, One of the things that some studies found was that single amputees and amputees with no social support will experience depression and anxiety 10 times more than those who are not. So please be aware of that. If you fall into one of those categories, um, reach out, get that help that you need. Um, this is your new normal. That's one of the biggest things that you're going to have to come to grips with and accept. This is your new normal. Before we get into this segment of the show, I want to thank OrthoMed Center here in Modesto, California. Great orthopedic group with some great surgeons, Dr. Holmes, Dr. Purnell, and Dr. Brayton. Um, Good staff there. If you are in this area, I work with them with a lot of their patients. I think Dr. Cash is there now, who's here in the Central Valley. Dr. Cash is over at OrthoMed Center with all these other great surgeons. Now, if you guys are looking for a orthopedic surgeon or you have a knee brace or something like that, reach out, contact them, let them know you heard about OrthoMed Center through Amp Life Talk Radio. This is your new normal. The loss of a body part can have a distinct but overlapping psychological consequence on you, the amputee. This can be bodily changes, alterations in the way an amputee or their family or others perceive their body, how they perceive your body, how you perceive your body, or the changes in your function level, alterations in activities and the roles that you play in these various lives will affect how you see this new normal life that you have. Any person who has undergone surgery or treatment that has led to the loss of a limb or body part should be asked how they feel about the loss. How do you feel about your loss? It's a very valid question to start with amputees to ask that question, as I think most amputees never have anyone ask them that question. No one ever goes down that road with them. So a lot of times we don't know how the amputee feels about limb loss. Patients should be asked about the effects on their mood, day-to-day life, relationships, and sexuality. Can you look at your scar as an amputee? Can you look at the amputated limb? Excuse me. Is it having any effect on your physical relationships? I would like for you to take some time and think about these questions. Feel free to message me at the end of the show or in private on a private message or email me to discuss them further if you are wanting to talk about those questions. If no one has ever really asked you about those questions and you have feelings, things you want to say, questions you want to ask, please feel free to contact me. It is important to discover how well your family is coping with this amputation. Most people don't think about that. We think about the person, the amputee, but your family goes through a lot too when you lose a limb. How does your partner feel about the effects of your operation, your amputation, your husband or your wife, your girlfriend, your fiance, your partner? Can you talk to your family about their feelings with regards to your amputation? These are all good questions to help us figure out our emotional well-being, not just with ourselves, but with our family and friends, our husbands, our wives, our lovers, our boyfriends, girlfriends. These are all important questions. The reason they're so important is because these people are a part of your life. And I think in order for us to have a healthy, well-rounded being and a well-rounded well-being, we have to discuss this with the people who are in our lives. Anything that increases mobility and enhances the patient's confidence and self-esteem will facilitate the necessary physical and psychological transitions to a healthier well-being. A well-conducted post-operative exercise program is crucial to patients to help them restore confidence in their bodies. It is so important. This is why I tell every patient PTOT is so important. People with damaged bodies long for the day when they will again feel strong and safe. I strongly suggest a cognitive behavior therapist to help you with the challenges that you're going to be faced with. They will help you and challenge amputees with their misconceptions of themselves and can be very helpful when you're having body image problems that are persistent. They also are a particular value for um, disturbance of mood and sexuality associated with the problems you're going to face with body image and amputation. Check out a cognitive behavioral therapist if you are going through it really bad with some of this. Um, I think they're a valuable tool in your overall well-being. Physiotherapists um, are important too in the rehabilitation picture and getting you back up to initiate the patients to help them reestablish hope so they can see the future with putting you on a good regime and workout program. They will help you form some structure in uncertain circumstances. Training is a symbol of not giving up on your life. Training, get exercise, outdoor activity, get active. To remain motivated, it was important that patients and amputees experience the training as something that is meaningful. It is an investment in yourself. It is an investment in your well-being. Amputees found it hard to come to terms with this challenge of losing a limb and having to live with a reduced mobility and independence. They also experienced that professional help support primarily um, addresses not just the mere physical aspects of their new life and situation, but their emotional. Studies definitely reveal that these things help them with their physical challenges related to amputation and the adjustment process, uh, which will include the change of your self-image, help you with the social isolation, despair, and a struggling to come to terms with this new identity of your physical impairment. These things are all crucial. These people are all important in helping you regain that healthy well-being. Okay. How do people react to sudden misfortune? That's a good question. How do you react to sudden misfortune? Think about that for a second. Are you a person that gets all doom and gloom? Woe is me, sky's falling. There is no simple answer to this question, my friends. Since individuals' reactions are all sufficiently varied and all different in every situation to misfortune, tragic, trauma, we're all different. We're all going to respond different. So, just to help you, there is no right or wrong answer. There is no simple answer to that. In general, the sooner uh, you get to walking, practice walking, you will start to begin a more favorable outlook with your life, getting it back. I encourage you to get up, get active, get the help that's out there. One of the things that I want to talk about as we're coming to where we're getting ready to wrap the show up, I find that a lot of amputee patients lack knowledge and education when it comes to prosthetics, the prosthesis, and moving forward with getting on with their life with their new device. These are key instruments in helping amputees deal with the adjustment to the new normal they have now. These are so crucial. Understanding all the components of your new prosthesis, the liners, the socks, um, everything, pin system versus suction system. These are all so crucial. Education and knowledge. If you need those, Amputee Coalition of America has a lot of information up on their site. I am more than happy to answer some of your questions here. Hopefully, some of the shows that I've done and will do will lead to some of that knowledge and education for you as a new amputee. But these are key instruments in helping amputees. Attitude, self consciousness, mourning of the absent limb, and rehabilitation. These things here, we all will experience it some way, some form, some fashion. The most important thing that every amputee is going to need is your attitude. Your attitude will help you overcome a lot of obstacles. By having the proper attitude, you will know how to deal with certain things that are going to come your way. And in conquering and completing some of the goals that you set forth for yourself, you will develop confidence, self consciousness. Being self aware of your new situation is so vital so that you can fully grasp where you need to be, but more than that, where you are. Self consciousness. People will look, people will stare, people will ask questions. Sometimes people will say stupid stuff. Self consciousness. How will you use that? How will you let it affect you? Your attitude will dictate that. Mourning of the absent limb. We all go through it in some way, some fashion. It's a tough thing to experience looking down or looking at a limb that is no longer there. My friends, I say to everyone, experience it. Don't push it down inside. Don't deny it. Don't try not to. Experience the mourning of the lost limb. It helps us process and deal with the new life we have. Rehabilitation. We all know how important rehabilitation is from me talking about it. It is going to be one of the key components to get you back up and get you moving, get you back in the game, my friend. That's the whole thing about this. I want to get you back in the game of life, living, breathing, laughing, enjoying all the things that there are to enjoy in that beautiful life that you have. My final thoughts, my friends. Life after discharging is associated with a feeling of despair and a painful sense of loss. But there's also hope with that of regaining some personal independence. The consequences of losing a limb gradually materialize as amputees realize how the loss of mobility will limit their freedom. After amputation, people experience a range of psychological and emotional reactions. Taking stock of your emotion or taking stock of your emotional well-being can help you identify the problems that hold you back and help you recognize positive aspects of your life. I want to say that again for all of you that are listening. Take a moment to take stock of your emotional well-being can help you identify the problems that are holding you back and help you recognize the positives that are still in your life. The following are a set of questions I want to ask you, and I want you to really work on these and think about them because Amp Life Talk Radio is a support talk show. I'm going to hit you with the tough stuff sometimes. And yeah, there's times when we do all the fun interviews, but I'm here to help you. I'm here to make those emotions come out. I'm here to help you process things. This is a support show. So the following set of questions I have put together for you, they will help you assess your emotional well-being. Now, for some of you over the last 2 weeks, if you've had an amputation, these questions will probably be very emotional for you. And for those of you who have had some time since your amputation, I still want you to participate in these and to ask yourself these questions, okay, and be honest. And I want you to think about how often you have been bothered by any of the following problems. I want your responses to be rated with not at all, several days, more than half the days, nearly every day. I'm going to put that out there one more time. So your answers should be one of the following: not at all, several days, more than half the days, or nearly every day. Little interest or pleasure in doing things. What is your answer to that question? Feeling down, depressed, or hopeless. Trouble falling or staying asleep, or sleeping too much. Poor appetite or overeating. Feeling bad about yourself, or that you are a failure, or have let yourself or your family down. Thoughts that you would be better off dead, or hurting yourself in some way. Trouble concentrating on things such as reading the newspaper or watching television. I am satisfied with my life. The conditions of my life are excellent. The conditions of my life are excellent. So these statements and questions, I would like for you to respond to yourself, not to me, but I would like for you to answer those questions truthfully to yourself with one of the following responses: not at all, several days, more than half days, nearly every day. Please go through those. If you find that yourself if you find you are concerned about some of your answers and you want to talk, feel free to contact me. I will definitely do my best to put you in touch with some resources that can help you. For the wrap up of the show, it's time to wrap this show up. Man, an hour goes really quick. I remember back in the day when I was scared to be able to talk for an hour. Season 2, episode 38, man, I'm rambling on. So as we get ready to wrap up the show, in my wrap up, this show clearly illustrates how the loss of mobility disrupts the amputees world in several ways. Amputees relationships to the world are disturbed, and this experience is experienced as a sense of exclusion from life. You feel like you're being left out. World's going by and you're just sitting at home. In spite of a general feeling of being all right, the reduced interactions and limited freedom were something that all amputees experienced as a essential loss. So you're not alone if you're feeling these things. But I do want you to do one thing for me. Setting goals are an important part of improving our well-being. I would like for you to set or make 3 goals. Write them down. Tell someone you trust and you know who will help you be held accountable for these goals. They will also keep them a secret between you and yourself. So between you and that person, these are your secret goals that you want to share with them, but you need them to hold you accountable. to work at these every day. Do something every day towards these goals. Doesn't have to be something on all three every day, just something towards one of these goals every day to accomplish it. Do that for me, my friends. And I love to hear from you as you start to chalk these off and say that they are accomplished. As we will have a part two to this show coming up in the near future. But please do that for me. I know and understand recovery is challenging and it can be a difficult process to manage the challenges of limb loss. So I want to give you 10 tips as I end the show. Connect with others. Stay positive. Get physically active. Help others. Yes, you can help others by sharing your experience. Get enough sleep. Create joy and satisfaction. Eat well, my friends. Eat healthy. Eat well. Take care of that body. Take care of your spirit. Take care of your emotional you. Deal better with hard times. And if you need to, get professional help if you need it. I want to thank each and every one of you for joining me here at Amp Life Talk Radio for another show. I hope you enjoyed this show and I hope you got something from it. All the people on YouTube, I will be editing this wonderful video so that you can have all the wonderful effects and I can clear up some of my errors. So stay tuned, everybody. Be patient on YouTube. I will edit the show and have it up in a couple of days. But for those of you here on Spreaker, you get to hear the live broadcast of me doing this show. It was a pleasure speaking to all of you and sharing this show with you. Please be sure to leave me comments on the videos, leave me comments on Facebook, rate me, review me, give me your criticism, let me know what I can do better. Let me know if there's a show you want me to talk about. We have some special guests coming up for the next few shows. So I hope you will enjoy the people that we have coming on. And then I'm going to be in Laughlin doing some stuff. So you're going to be still getting shows and you're still going to be getting stuff. If I am out of town and I can't do a show, I'll post it on Facebook just so that you guys know. I may just do a live show there and then bring it up when I come back to the studio. Remember, you can see us on YouTube, live stream video there. You can listen live on Spreaker. Download the app or go sign up. Just register in. It's a really simple process, but download the app is the easiest thing to do on Google Play Store. But if you want to listen live, Spreaker.com is where you can do that. You can leave me any emails or comments at amplifetalkradio.com. To find the show, simply type in Amp Life Talk Radio into a search bar. I don't care which one you're using, but if you type in Amp Life Talk Radio, doesn't have to be just one long word, just like you would write it out, Amp Life Talk Radio, into a search bar and click on the results that come up. You'll find me somewhere on one of our platforms where you can listen to the show being recorded live or later on in a podcast. Look for my face or my flaming mic logo, and you'll know you have the right place. For those of you that love Instagram, yes, we are on Instagram. And yes, I will be taking a lot of pictures from the Spartan races that we have coming up and posting those over on Instagram. So make sure you like Amp Life Talk Radio and all the social media platforms that we are on. If you miss a show, that's a live show. Trust me, streaming the show on YouTube is a good bet. But if you want to listen live, go to Spreaker.com. You can catch every episode if you happen to miss one of the shows on iTunes, Spotify, and iHeartRadio. My friends, I want to thank all of you for tuning in to another episode of Amp Life Talk Radio. I am so appreciative of all the support and the comments that I get from you. And I want to thank you all.
You are listening to Sean Harrison on Amp Life Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.